Every year, about 10 million people around the world fall sick with TB, and sadly, over 1 million people die from it. Now, TB is a disease that has a cure, it's a disease that is preventable, but people still die from it. Why? That is why it is important to listen and pay attention to this video till the end. In case you are wondering what is TB, TB is a short for tuberculosis. Now, tuberculosis is an infectious disease that is caused by a bacterium called Mycobacterium tuberculosis. Now, this bacteria primarily affects the lung, but it doesn't stop there. It can affect the brain and the kidney too, and it can affect absolutely anybody. How does TB spread? Now, before I tell you how TB spread, I need to clear some common misunderstanding. TB does not spread by shaking hands, it does not spread by kissing, it does not spread by hugging, it does not spread by sharing a plate of food, it does not spread by using the same toilet with someone that has TB. Tuberculosis primarily spread through the air. How? Now, when someone that has tuberculosis coughs or sneezes, he or she releases tiny droplets that is carrying this bacteria, and when anyone that is close by inhale this bacteria enter the respiratory tract and settle down in the lungs. Now, that is just the beginning. Also, it is very important to know that tuberculosis is a zoonotic disease. That means it can be transmitted from animals to humans by taking unpasteurized or raw milk, or by eating uncooked or undone meat. Now, another interesting thing about tuberculosis is that someone can have this bacteria present in the lung and still not fall sick. Interesting, right? Let me tell you how. Now, tuberculosis has two forms, the active form and the latent form. Let's start with the latent form. Now, for you to understand better, let's call the latent form the sleeping form. Yes, so during this stage, the bacteria is present, but it doesn't cause illness. The person does not cough and cannot transmit the disease because the body system is strong enough to hold the bacteria under control. But once the body system becomes weak, either because of stress, illness, or malnutrition, this sleeping form can wake up, the bacteria can wake up, and then this is when the bacteria will cause illness, and then it can be transmitted to another person. While the active form is the form whereby the bacteria is active, they are rapidly multiplying, they cause illness, you cough, and then it can be transmitted to another person. That is why it is important to do your testing to know if you have tuberculosis. Sometimes it's there, but the sign is not there because it's at the latent stage. So it's important to do a test. What are the symptoms of tuberculosis? Cough lasting more than 2 to 3 weeks. You're having chest pain or pain when breathing. You're coughing up blood or bloody mucus, loss of weight, loss of appetite, fever especially in the evening, you're having night sweats, you're having fatigue and weakness. These are symptoms of tuberculosis. If you are noticing any of these symptoms, you need to check in with a doctor. How do you treat tuberculosis? Like I said earlier, tuberculosis is curable. Treatment involves taking antibiotics that's going to be prescribed by a medical practitioner for at least 6 months. Now, the mistake most people make is by taking this medication for few weeks or few months and then stopping because they feel better. Now, this can lead to another condition known as AMR, antimicrobial resistance, whereby these mycobacteria become resistant to this drug and it becomes harder to treat. So it's important to finish those medications. Now that you know what is tuberculosis, you know how it spread, you know the symptoms, you know that it's curable. Let's talk about the prevention. 1. You ensure you cover your mouth when coughing or sneezing, especially in public spaces. Ensure your homes are well ventilated, avoid crowded areas, avoid unpasteurized milk, ensure your meats are well cooked before consumption, get tested early. If you're on medication, finish your medication to avoid other complications. And yes, there's a vaccine for tuberculosis, it's called BCG. It's usually given during childhood, which provides protection against tuberculosis. Now, before I go, let me tell you the biggest barrier to any TB. It's not medical, it's because of stigma. Now, many people are afraid of being isolated, they're afraid of being judged, they're afraid of losing their job if others find out that they have tuberculosis. And tuberculosis is not a disease of death, it's not a disease of weakness. In fact, it's not a disease of immorality. It's a disease just like malaria. It's a disease just like pneumonia. It's preventable. It's curable. So if you know someone that has tuberculosis, please encourage them, support them to finish their medication. Don't isolate them. Don't shame them. Compassion saves life. And yes, together we can end TB.